No, Cassidy, I think it's time we have to address something I know, and also in you. We've been getting a lot of questions about this over the last several months, and there's some big changes coming to your life.
Yes, there are some big changes, to the way I've been looking lately, and I have to clear it up because Jonathan likes to tell people that I just like to eat too much. And
don't listen to her.
That is not, well, I'm not going to say that's not the case. That may be part of it, but we haven't officially announced it just yet on WJCL, but we did want to announce, even though I'm sure it's pretty obvious by now, I am 8 months pregnant. My husband and I are expecting our first baby at the beginning of April. And Jonathan, of course, we're all very excited, and everybody here at work has been so sweet and so excited for us as well. But it can be a little bit scary sometimes, just especially when it comes to health issues. You want to do everything you can to keep yourself and your unborn child safe. So I stopped by Memorial Health last week to talk to the experts there about a common virus that, if contracted during pregnancy, can actually be very dangerous. Take a look.
She is an angel. She's so sweet. I got one of the really good babies.
Katie Kirby is just like any other doting mother.
She sleeps through the night. She only fusses when she's tired or wants attention or hungry. So we've got a really sweet little girl.
Sharing pictures of her 3-month-old daughter, Kinsley. But this first-time mom doesn't take having a happy, healthy baby for granted.
For expectant mothers, pregnancy can be an exciting but also very scary time. You want to make sure you're doing everything you can to keep yourself and your baby safe. And experts here at Memorial Health say there are some things that women like myself just don't know enough about.
Kirby's a pediatric physical therapist at Memorial Health University Medical Center in Savannah and has seen firsthand just how dangerous certain prenatal illnesses can be. So she says when she was diagnosed in her first trimester with cytomegalovirus, commonly known as CMV, she felt a range of emotions.
I think when most moms go through this, you go through a phase of like, well, what is CMV and what does it do? I knew exactly what it does.
Libby Malfris, a genetic counselor at Memorial, says CMV is actually a common virus that can infect almost anyone. But if you're pregnant, there's cause for concern.
When it does go to babies, particularly in the first trimester, it can cause anything from the baby's not growing well to blindness, deafness, neurological damage, mental retardation, and unfortunately sometimes even death for those babies.
So how do you know if you have it? Dr. Arthur Baker, a maternal fetal medical physician at Memorial, says that's the scary part.
It's something that you would never know you even had. It's like the symptoms are typically that of like a common cold. You might feel a little fatigue or have a fever, low-grade fever, some aches and pains.
Dr. Baker says for Katie, her job in healthcare could have contributed to her getting the virus.
If there are healthcare providers, they work in hospital settings, especially women that work in childcare settings, so daycares, kindergartens, that they're at much higher risk of being exposed to the virus.
He says if you're pregnant and work in one of these fields, you should talk to your doctor about getting tested for CMV.
There is some treatment while they're pregnant, and that getting this treatment before the baby's born can reduce the chances of significant complications for the baby.
Which is exactly what Katie did. And after delivery, her baby was tested too. What resulted was some very good news.
To have that test result, to know that it never passed her was amazing.
Dr. Baker says there are some tips to help you from getting the virus in the first place, and it may surprise you just how simple they are. He says, wash your hands frequently, don't share spoons or utensils with kids, and try to avoid kissing children, even your own, on the mouth. And he says if you're expecting, there is one rule you should follow above all else.
I think the best things you can do are to honestly take care of yourself. I mean, so many people are focused on their baby, and that's important, but having a healthy body and a healthy outlook is probably the most important thing.
She is a cute, healthy little girl now. Dr. Baker says treatment for CMV is still somewhat of an experimental stage, but he says research has proven it can be successful in some cases. Now, right now, it's not mandatory for every woman to get tested for the virus, but he says he could see that changing in just a matter of years, along with a vaccination that could protect all women and their babies from the virus entirely. Now, one more tip Dr. Baker offers up. He says if you're pregnant and you haven't gotten your flu shot for the year, you should do it immediately. And yes, I know it's on the tail end of flu season, but he says women who get the flu while pregnant get much sicker than those who aren't, so better to be safe than sorry.